I hope my slide is visible.
Yeah, we can see them.
All right. Thank you very much for this opportunity. And as you said, it is Sarpa I will be presenting because this is one of the more structured programs which we initiated, and will talk about the challenges which we faced and how we overcome these challenges. I hope my audio is clear because I muted my all other speakers, and if there is a problem, let me know. All right. So we run a few technology-enabled programs in India, and Serpa or Serpent, the concept is the same, and the Serpa is more focused on a state. And I would like to, as this is a small group and almost everybody is involved in, snake bite mitigation project. So I wanted to focus on Serpa and how, the government how the partnership between government and not for profits and general public ensured that it is successful, and what is the result now. Today it is about 5 years we completed. So 5 years is a lot of time for learnings and experimental things and also fine tuning things. So I'll be taking through that journey of Serpa. Um, So I don't think that I need to tell these things to people who are sitting here. Like any other country, we in India we also have this major questions that whether it is a health issue or a wildlife issue, because snakes are protected as wildlife in India. So when a snake kills or a snake bite a person, it is considered as a human wildlife conflict. So who is actually responsible, whether it is the forest department or the health department? And also, there was always a challenge between the state or central government, whose responsibility it is to deal with the snake bites, and the paradoxical problem that India manufactured probably the largest quantity of anti-snake venom, but in many hospitals across India, anti-venom is not available. And what is the role of education, outreach, and preventive efforts that will reduce the number of snake bite incidents and in turn snake bite death. So all these problems we had it all. So as you asked me a few questions, I should be answering a few questions. So I thought I'll restructure my presentation a bit. That how it is. So I started indiansnakes.org as a website in 2010. This was purely because of a response to my own problem, because getting a book on snakes was difficult. There was only one book available, the book Snakes of India, and then a couple of other books. But then that is when the whole idea, in way back in 2010, that why don't we have a website on Snakes of India? So that is how me and a couple of friends, we started this indiansnakes.org website. With the initial plan was to have a website only for snakes, to as a digital field guide for um, snakes. And then in 2017, I mean, over a period of time, various things happened. And 2015-16, we started thinking about a mobile version, and it started as a mobile application. And from 2020, we branched out into Serpa and Serpent. So in 2020, what was the reason behind having a snakebite mobile application was that, of course, we were a bunch of people who were interested in snakes, but snakebite was not in the initially snakebite was not our major concern. But when we started working with the human snake conflict issues, we understood that we should have a mechanism which will ensure that we address the human snake conflict. And that is when we thought, why don't we have a centralized real-time emergency management and rescue program? I mean, India is big, India is diverse, India is vast, and the snake related issues are also highly, scattered across the country. We have a number of people who are snake rescuers or snake experts across the country, but when there is an emergency, how to find this, expert? People have a snake in the evening in their house, and then suddenly there is panic and they don't know whom to call. I myself was part of teams which set up rescue networks across the country, or various states. And I understood we need a kind of a mechanism to automate this process. So uh, that is when I started discussing with forest departments and government agencies, and that is when the whole idea of a mobile application came. So the first thing was to create a platform, create, if you can order a cab or if you can order food online, so why don't we enable a platform to get the services of an expert in case of a snake emergency. So that is how the whole idea came. And also we were printing a lot of outreach and education material. We were taking printouts of posters, flyers, and all. But if you can deliver all these things in a mobile application to people far and wide, then the outreach is very high, and it will also reduce our costs. For example, if I have to take a printout of a poster which will talk about snakebite first aids, instead of printing it and shipping it to the target school or community, why don't I make it as part of a mobile application where people can download it? So it is basically both the applications, whether you call it a Serpa or Serpent, it is part of an initiative where we thought we will put all these things together. So that's the story behind it. And now serpent, I call them the subspecies across the country. So the serpent is the main idea, and the sarpa, which I'll be talking largely about, the state of Kerala is one, and we started in the other state of neighboring state of Tamil Nadu, and also we got two more states now coming in, Rajasthan and Odisha coming in, because these states actually looked into the whole sarpa success, and we are trying to replicate this across these states. Let me tell you, I'm not taking any tall claims that it is very difficult. One of the major thing is to get the support of the government, get the support of rescuers, and get a network established. All these things are very important in this. Many times people tell that, oh, it is wonderful that you have a technology platform which addresses the situation. So my opening remark is that it is not the technology platform. The technology platform can do nothing unless and until you have a system behind it. You have a lot of people behind it. You have got a response mechanism behind it. So this is my biggest learning, that having a mobile application, having the best technology in your hand is not enough. You need a mechanism behind this thing. You need a mechanism behind the platform. You need people who will use the mobile application and respond to an emergency situation, whether it is a hospital which is accepting a snake bite patient, or a rescuer who will go and snake emergency call. That is the most important, and that's a crucial element in the whole system. So how does Serpent or Serpa work? It is, as I told you, the mobile application can be used by various sets of people. It can be used by general public who's interested in knowing more about snakes, or they have a snake emergency, or it's a school, it's a person who wants to know about snakes, so they can use it. It can be used by a rescuer who is certified and who's undergone training. So that rescuer will have a different interface of the mobile application. Whenever there is an emergency in his area, that emergency will be automatically transmitted to the rescuer. Then in SERPA model, we have district level administrators, that when you have large number of rescuers, when you have about 1,000 rescuers managing snakes, you need administrators who will look after this thing, because snake rescue is a professional job. So we don't want people to do funny things like, posing with venomous snakes for photographs, or, doing social media based stunts, etc. So we have people who manage these rescuers to ensure that they all follow certain rules, regulations, and guidelines when they rescue and handle snakes. And the other set of people are the hospitals, where hospitals where antivenom based treatments are available is also listed in the mobile application. So the hospitals also got an interface. Let me also tell you that we are in the SARPA initiative. We are updating the whole interface with hospitals reporting snakebite treatments through the mobile application with the government, because government is a partner in the whole thing. So any snake bite which is coming to a hospital for a treatment, they have to use the mobile application and update it to the central database. That is going to be rolled out in a few months' time. That is being planned. So all these things are managed through a cloud-based system, which is sitting in an Amazon web server, which is managed by a team of technical experts and a few analysts who will be looking at various aspects of it, who will be doing day-to-day monitoring, etc., of the entire system. Um, so that is it. Now, the most crucial question is that when you start something like this and you start a mobile application, uh, you know, my biggest challenge was that will people use the mobile application? So this is the user map of Sarpa. Kerala is on the lower left corner where the map is absolutely black. That is where the user base is largely focused. And in the background, what you see is a zoomed in version of the mobile of Kerala, and it is one of the cities, one of the biggest cities, Kochi. You can see the download density. So whenever somebody download and install the mobile application, we mark their GPS location. No personal information is gathered or no privacy is intruded. But just to understand that from which geographical location they have downloaded the mobile application. It took a lot of effort and a lot of public relations or outreach activities to ensure that people download the mobile application. So first thing, let me tell you that the mobile application is downloaded and used by people. And if you can look at it, every kilometer you have a mobile application user as of today. This map is a couple of days old. So you ensure that your mobile application has reached to people. This is the control panel of the Serpa mobile application. And one of the interesting things which you can see is that it is managed by the government, Kerala Forest and Wildlife Department. So it is taken over by the government. So that is one very interesting thing that, whatever initiatives which you do, when you have the government on your side, a state government and a department on your side officially, that is when it makes a lot of difference. So this we can say that this is the government's program. And a couple of months back, the chief minister of the state actually adopted the program and said that this is part of my office's 10 activities which we'll be doing for the people. I'll come to that why it got political acceptance. So one thing is that you need bureaucratic and you need a political acceptance of your initiative. And you can see there is a number of users. These are not the downloads. These are actual users currently present, I mean, currently using the mobile application. This is real-time users. If you We have about 50,000 people using the mobile application, or in 50,000 to 51,000 mobile phones, the application is currently installed. Another thing which I learned is that don't go by the number of downloads of the mobile application in the lifetime of the application. People download, people delete the application when they need it, they again install it. That's something which I saw. We have about 1,000 active snake rescuers, and in 5 years, we rescued 58,636. Now we just crossed the 60,000 a day or two back. That's more than 10,000 or approximately 10,000 interventions per year. And also, we get photographs from people for identification. It can be from hospitals, it can be from people who found a snake in their house. When there is an emergency, they send photographs for identification. And we got 84 hospitals in the state which are listed in the mobile application, where we have verified usage of antivenom, or the hospitals are armed with antivenom to treat snake bite emergency situation. So that is what the whole information is available. And we also get a lot of scientific information. Like this is a map which is showing that snake rescued in the recent past. So whenever the rescuers are going, this is one of the most densely populated cities of Kerala, and Kerala itself is the highest human density, human population in the country, and this particular city is absolutely got a high number of people. But you can see such an urban situation, you have snakes. And if you look at on the towards the left side of it, Santa Cruz Cathedral Basilica area, that's a little island kind of a situation. This is Kochi city. That that place has got a large number of snakes. Now, when we look at this kind of data, we are also understanding a lot more about the presence of various species. This particular landscape, even though it is a highly advanced urban environment, the Indian rock python, which is supposed to be a forest snake, that is the highest population in this region. So we are also looking at what are the reasons behind, what are the factors, what are the ecological factors which leads to this kind of a population in an urban situation like Kochi. So we get a lot of scientific information about snakes. Also, if you look at it, we keep data from 2021. When we started, it was 2021 August, and there is a steady growth of rescue every year. Last 5 years, if you look at it, the number of people using it and the number of incidents where our snake experts are going to people's houses and removing snakes is steadily increasing. This data is probably a month old, and that is further increased in 2025. So the acceptance level, the response level, everything is increasing. So here again, I would like to tell you that this is happening because you have a set of people behind it who will go and do the actual rescues of snakes. If you look at and this data is coming to us in real time. I don't need to download the data and put it in an Excel sheet and analyze the data. I get this graphs in the system automated, and in 2025 I want to analyze that what snakes we are finding in houses. So interestingly, spectacled cobra, about 5,000 snakes which are removed from the houses. And the surprise element here is the Indian rock python, almost 3,000 snakes, non-venomous large pythons entering into houses across the state is a very interesting thing. We have to, I mean, we do have our theories currently in place, but unless and until a study is done, we may not be able to publish it. But it's interesting to see that you get large number of pythons, and we don't see that many Russell's vipers or even um, great. So the number of Russell's viper here is about 563, about 600. So now you know the ratio between the probable encounter between people and snakes. What snake could be the highest one? It's definitely it is spectacled cobra. So this kind of analysis, this kind of data coming in is also helping us to understand the diversity of species of snake in human dominated areas. And this is how we get identification help. Whenever people see a snake in their backyard, they send the photograph for identification. And I think I have, So this is how we get a photograph. So we'll be able to identify the snake and tell the person that, okay, in this case, it is a harmless bridal snake. So we immediately, somebody who's manning the back end will inform them that, okay, it's a harmless snake. You don't need someone to come there to rescue the snake. This is also one way of avoiding a lot of human effort traveling sometimes 20, 30 kilometers at night to rescue a non-venomous snake. So we tell people that this is a non-venomous snake, you don't have to worry, especially when the snake is outside the house, and all we ask them that ensure a safe passage for snakes. So this is also creating a lot of confidence in people. And the positive mindset change what I am seeing in last 5 years is that whenever we identify a non-venomous snakes, people say that, oh, that's fine. I mean, we don't mind. It's a non-venomous snake. We don't want somebody to come and remove it from our house. So a lot of efforts are also taken in this direction. Now, when you get a snake emergency, we get it in real smart way, that we get this in real time. It has got bilingual options. You see the regional language script that the description says that it is near a house, and the situation is outside a residential building. So that is selected. So somebody has seen a spectacled cobra. We get a photograph of the situation. So the rescuer is kind of prepared what kind of a situation he will be dealing with. This you can see that the little tile. I'm not sure it is very visible on everybody's screen. So there is a small cobra hiding in a broken tile or something, and also the GPS location. So the nearest rescuer will get an automated update, and he will get the Google location. All he has to do is that activate his Google map, and then he can reach the location. So we made it like zero human intervention. There is, you don't need to call somebody. The nearest rescuer will get the alert, and he can go to the location. And the people who man the control panel will know that in real time how many rescues are happening wherever you are. I mean, our rescue coordinator can be any part of the world, but he will know that how many rescues are happening. And we are also able to look at individual rescuers. Like I can look at each rescuer and see that what areas they are rescuing, what snakes they are rescuing. So we are able to manage the whole rescue response mechanism using the mobile application. And also we mapped all the hospitals, both private and government hospital as mapped in the system, and GPS based navigation is given. And also the hospital details are already given, so that somebody can call up the hospital and say that, okay, we do have a suspected snake bite patient coming into the hospital. But more than the app, I would like to say that we, as part of the government initiative, as part of now we call it as the SARPA initiative or SARPA model, we contacted all these hospitals through the government channels and also directly, also by individual rescuers in that area, ensured that they are aware about, the snakebite emergency, and also had sessions with the doctors, with the experienced doctors about snakebite management and emergency procedures, so that the hospitals are ready and they're willing and they are equipped to treat snakebite emergencies. So it is not that you just give the name of the hospital in the mobile application and everything will work. We ensured that all these hospitals do have antivenom, and also periodic checks are done. And the other thing which we have done is that we kept all our outreach material within the mobile application. So the on the left side is the common snakes of India. So if anybody wants to take a printout of posters, various posters. I mean, it is common snakes of the India, common snakes of the particular state, or common venomous snakes. A number of posters and short videos are available. Especially these posters are downloadable and they can print it. So this also reduced our cost of printing material, because I personally a few years back, we printed all this material. So printing is okay, but transportation of this material in safe covers or envelopes or tubes and send it to a particular person, that all took more resources than actually printing the poster. So we got cartoon based things like which are children friendly, to burst the myths about snakes. So we used some caricatures. We got a good artist to draw these things, which communicated with people in regional language. We also got a snake and ladder game, which is not part of the mobile application, but all whatever we could share through the mobile application, we ensured that these things are available within the mobile applications for people to download it. Now, the major thing is the community interaction, that we do a lot of workshops with schools. So, that's the SARPA volunteer who's trained and certified as a volunteer. And there are structured workshops across the state. So, these educators are not the regular rescuers, these are rescuers who were selected further and undergone a set of trainings to conduct sessions. So, there is standard presentation, there is a standard video, there is a standard program which he has to deliver in a school. No, nobody can go to a school and do whatever they want. So they are given a set of presentations, a set of resource material, and a structure, so that they will deliver workshops exactly like that. So that ensured that we standardize our training material, we standardize our outreach material, we standardize our trainings. This greatly helped large school gatherings, and it became a mandate for schools across the state, because unfortunately there were a couple of incidents in schools. After long holidays, after 2 months of holidays, children came back to school, and there were incidents of snakebite happening within the school or in the premises of the school. So we thought that it is a good thing to intervene at school level, where we get a lot of children together and we are educating. Now, so these are all things what we have done as part of the SARPA or Serpent initiative. Now, interestingly, if you look at it, we looked at data. Um, the human wildlife interaction caused a lot of deaths in the state. So, when we looked at this particular data between 2016 and 2025, we lost about 700, 800 people across the state. But most of it was because of snakes. That 586, I mean, large number. Kerala is a wildlife rich state, and there are a good number of elephants, wild pigs, and tigers, leopards, etc. But if you look at the number of people killed by tigers is eight. I know. I mean, even one human life is lost to due to wildlife interaction. That's not a good news. But overall, this was, widely, talked as death due to wildlife interaction. So when we looked at snake and we understood that if we actually bring the snake bite death down, then the overall, human wildlife death will come down. So that was the political or PR strategy which we applied. That if we want to bring the tolerance level higher between people and wildlife, then we have to reduce the human snake bite deaths, and that is what happened. So now we started the zero snakebite death initiative in the state, where if you look at it, in 2011 to 2019, The deaths are in higher numbers. These are hard data. This is hard facts. This is snakebite death. And in 2019-20, that is when we introduced the SERPA. Now, if you look at it, you see there is a drastic reduction in the number of deaths. Here, I'm again telling it is not just because of a mobile application, but the kind of initiatives which are centered around this whole SERPA initiative. The number is steadily coming down. I mean, we are now this year, 2025-26, we are analyzing every bite case, every bite death case. These are deaths. These are human deaths. We are analyzing every death case. Why that particular death happened? Was it due to delay in reaching the hospital? Was it due to the problem or a failure of the hospital to recognize that it is a snake bite incident, or was it because the person went to a local healer and then went to the hospital? Whatever the reason is, we are analyzing it. But what we are seeing is that there is a reduction in the snake bite deaths in the state, and that's clearly after the SARPA initiative. And that is when the political leadership of the state adopted the whole program. When they saw the hard data, they understood that okay, this is a good way of reaching out to people and telling them that the government is doing good for you. And that is when we started this whole zero snake bite death initiative in the state. And the other thing is how you manage media. Because when you do all these things, we learned it in the hard way that you need a lot of media support, which we got in abundance in Kerala. We got the local celebrities, like, the first photograph. That guy is a famous movie actor in Kerala. So he came and he undergone a day's training and he became a brand ambassador for the whole project. So he made a short PSA for the people in regional language and he talked about it. The newspapers covered it, and these things actually works as catalysts or force multipliers to government agencies, to policymakers. Oh, this is something good. This is something which is getting attention. This is something which is putting us in positive light. So that media support is something which we slowly and steadily acquired. So that really worked. And Sarpa Padam to cover all educational institute. This is a recent update that every school has to conduct sessions on snake safety. Now that's now the education department has taken it up and they say that we have to do it. So all these things work. I mean, all these things based on the good work which you have done, the way which you positioned it within the government circle, and also how you ensure that you get a media support. And also, we are addressing another larger issue across the country, across the state. We got all this. Pardon me, I used this word, stupid snake rescuers. I mean, people who handle snakes carelessly, irresponsibly, and they die. And just these kind of characters. I mean, I'm very sorry, but this is a major problem which we face across the country, that people do rescue snakes because nowadays, if you rescue a snake dangerously, you will have more YouTube viewers or Instagram followers and Facebook likes. So a number of these rescuers started doing this. So the whole SERPA initiative ensured that we ban all this kind of activities from the state, that nobody who does stunts on camera for social media is not part of the SERPA initiative. And we had a few celebrity snake rescuers in the state who refused to, change their ways, but then they had to be out of such activities because now only trained certified rescuers can handle snakes. So we not only saving the unsuspecting snakebite victims, but also all these people who could have been increasing our number of snakebite deaths in the state. I don't have much of a sympathy to this kind of characters who don't look after, I mean, who don't respect snakes. So when people ask me about snakes, oh, Jose, you love snakes. I say I don't love snakes. I respect them because a cobra is something like it's as bad as a grenade in your hand. It can put you on the wall. Uh, so we ensure that this kind of practices are also discouraged. So altogether, this is what is the SERPA initiative, and we have a great partnership with the State Forest Department. It is supported a bit by the Wildlife Trust of India, my organization, And we have a technical team, our own technical team. That's another beauty of it, that we don't depend on somebody else outside for the technology development. And we partner with the Madras Crocodile Bank for various things, and finally the website. And I dedicate this to the success of Sarpa. If you call Sarpa is a success, it is not because of the mobile application. It is not because of my uh, ability to make it a successful application. It is because of this the large network behind it, the set of people, the 1,000+ volunteers and the coordinators who are ensuring that whenever there is a emergency of snake or snake related emergency, they respond to it. So that's the biggest learning for me, that mobile application itself is not the answer, or technology itself is not the answer. I conclude here with saying that technology is like a screwdriver or a player, that it is up to the person or up to the mechanic who use it. So, you always consider technology as the tool, and you should have the ways and means and the ability to make the best out of it. That's all. We'll be happy to answer questions later, but that's from my side. Thank you very much.
Thank you so much, Jos, for this presentation. And I think that message is really powerful as we all hear about all of these apps that are coming up. But I think that there's so much work that goes behind making an app function with people. I'm really sorry to do this because I know that you have a lot of questions, and I'm also going to be dropping some questions in the chat. But just out of respect for our other speakers' time, I'm going to have to say that we should move on to Ms. Priyanka
Yeah.
Kadam's talk. So everyone, please feel free to leave your questions in the chat. And if Josie, you're able to respond to those, that would be lovely. So I'm very excited to also welcome Ms. Priyanka Kadam, who, if we discuss Sarpa as kind of the Uber of snake rescuers, then we can discuss Priyanka's app has a lot more to do with the health sector side. And so I don't want to spoil anything. So just without further ado, thank you so much for coming and sparing this time. Priyanka, please feel free to share your screen.
Thank you, Chloe. Can you see my screen? Is my screen visible?
Yes, now it's visible.
Okay. So today I will be speaking on, let me just first, it's okay. Okay. So the Snakebite Assistant app, that is what I'm going to talk about today. And this app has loads and loads of information for different, any kind of profile or background, and you have information for that person in this app. So let's look at what are the things. And the one thing that I will touch upon is the medical side of the USP of this app is that it's a teaching tool to help, say, medical students, medical college students, or young doctors who are inexperienced and who do not know how to treat snake bites, paramedics, nurses. So this app, as we go through the different slides, you will understand, what exactly I am trying to say. This app has both Android as well as iPhone version, and it is easily available in the Play Store. So the people who were behind building this app, the core team comprised of Dr. Thomas Younghans. This is Dr. Thomas. Dr. Mauro Bodio, who is from Switzerland. He's a field biologist. Dr. Thomas, he's a very senior clinician from Germany. And myself, we were a part of the WHO working group, and that's how we thought of collaborating and building this app for India. So right now, the prototype is for India. It can be made for any other country, but all the information and the treatment guideline, everything is as per the Indian Standard Treatment Protocol. This project was supported by Swiss TPH and the technical partners, the people who built this app. There's a company called Wow Labs based in Bangalore. They built the app, and Junidas is another tech company from Germany, which is supporting a platform called vapaguide.info. So a lot of information about the snakes and distribution and all those things, and the treatment part is pulled out from that platform. Vapaguide.info was built again by Dr. Thomas and Dr. Mauro Bodio over a period of 20 years. And that, again, is a very, very informative platform. It covers all kinds of animals and creatures which are venomous or poisonous in nature, and which can, affect human beings. So this app was built over a period of 2.5 years, and we had 3 meetings in Madras Crocodile Bank. The people who advised, on the content were clinicians, herpetologists, anti-venom manufacturers, ambulance service providers, and social activists. That's Rom Whitaker there, and so many of our colleagues. So the Snakebite Assistant app intuitively guides the user through the steps encountered in a venomous snakebite envenoming. The app caters to 4 different profiles: victims and first responders, that is one. And in under this profile, like depending on what you choose, when you download this app and you open it, it will prompt you to choose, your background. Which profile do you fit in? And depending on what you choose, it will then take you to those levels. So victims and first responders, it will have the general information about awareness and prevention, and first aid, all those kinds, the do's and don'ts. All that information is there under this level. You also have links to look at short videos in 12 regional languages under this level. Then you have the paramedics. So under the paramedics, again, you have the information about the patient. Who is the patient? What is the background? What is the condition? All those information the paramedic can, upload in the app. Now, again, this app is a teaching tool. It is not to be used, to treat snake bite, like as a live case, because snake bite, it's a medical emergency, and if you waste time adding information when the patient is very serious, you're going to lose the patient. So today, what I will cover is the primary healthcare level. That I will cover in detail so that, everyone gets a general understanding of exactly, what kind of, information is added to this app. So this is how it looks. Victims and first responders, we have already spoken about it. The paramedics, primary health care level, and the secondary healthcare level. So this is where the PHC or the CHC, Community Health Center, and Primary Health Center, this is where they will come. It's at a grassroots level which is closer to the villages, and therefore the first point of contact for a snake bite victim. And the secondary healthcare level means the tertiary hospital or the district hospital, where you have the ICU, you have more sophisticated infrastructure and can deal with critical patients. So the Snakebite Assistant app, it has the education and training material which is there in this app. It if you click on this, it will give you general public and it give you healthcare, health professionals. So under general public, again, I've already mentioned the information that is there, awareness, prevention, first aid, do's and don'ts, all those things. And under healthcare professionals, again, you have different kinds of profiles. So you have paramedics, you have health center, you have medical doctors, you have hospital administrators, and medical colleges. So depending on who you are, the information that you need, it is all there in this app. And this information is all a part of the WHO guidelines. And the treatment part is the Indian Standard Treatment Protocol. Now let's look at the primary healthcare level. So once you choose primary healthcare level, the app is going to ask you whether the patient that is in front of you is that patient critically ill patient, or is it a patient who's not showing any signs of envenoming. If it is a critically ill patient, if you start making a new case, you're going to lose that patient. So critically ill patient, directly you will go to ABCDE: airway, breathing, circulation, disability, and exposure. And this is the chart, how you have to go about doing the assessment for a critically ill patient. Now, suppose if the patient that is in front of you has been bitten by a venomous snake. In our case, we will be looking at a Russell's viper victim case, in the coming slides. But suppose if this patient has come to you and is not showing any symptoms right now, uh, the app will ask you, do you have antivenom available? If you say yes, if you click on yes, then it will provide you links of what is the initial dose of antivenom that you have to give as per the standard treatment protocol. The app is not going to talk about what are the supporting drugs that also have to be administered, because that kind of assessment has to be done on the ground. It cannot be done remotely. Now, suppose if you say that you do not have antivenom, then there are links to show you how to stabilize that patient and how to refer that patient safely to a secondary healthcare level where the antivenom is available. So let's look at how to start a new case. So a new, say, a second year medical college student who's learning, a lot of things about how to do, treat different cases. So this is a very, very good app for such people. The app, because there is also a concern regarding confidentiality of the patient, the app will warn you that you have to code word the patient's details, not add uh, uh, personally identifiable information and compromise the patient's privacy. So once this is done, then it will ask you to do the clinical assessment. So the time, since snakebite provides information on the time ranges of when the venom effects set in. In the case of our patient, 1.5 hours has passed since the bite. When the bite had happened, he felt a sharp pain, has vomited and fainted. You observe an extensively swollen right hand and his gums are bleeding. He's sweating and has vomited again. And this patient is in the state of Kerala. So once you, the next step will be the app will show you that when do the venom effects set in, So it can happen from anything from the first minute to almost 1 hour. The local effects How long will it take, to show? The necrosis will take a couple of days to show. The bleeding and clotting effects, when does that start? It will start little bit. This is a time range, but it's not that it's an absolute information. There will always be cases where the patient will be showing some a very atypical kind of a symptom, so that cannot be all the cases cannot be included in such charts. The bleeding and clotting effects, basically in a viper bite, when will that start manifesting? It will happen a little before 1 hour, and it can take almost 8 hours sometimes to show. Neurological effects. This is when the patient is bitten by a neurotoxic snake. But for example, in Kerala or many of the South India states, uh, in Russell's viper bite, many times neurological symptoms also manifest. So this can show from anything between 20 minutes or so to 10 hours. But again, here, I have seen so many cases in crate bite where the symptom has manifested after many hours. The maximum I have seen is 48 hours. But there is a doctor in Maharashtra called Dr. Dilip Punde. He says he has seen a snake bite case, envenoming, actually showing after 56 hours of the bite. So these are atypical cases. Generally, this is the time range. Muscular effects, how long, cardiac effects, how long, renal effect, all these things will, this will show you. This is a teaching tool, so it is teaching the user about different snakes venom, and how long they can expect for the symptom to manifest. Now, let's start the clinical assessment tool. So we will start with the patient, all the details of the patient at hand. So immediate and sharp pain, yes. Allergy to any drug. So this person is allergic to penicillin, for example. So any kind of medication that the patient is taking, any kind of past medical history, that has to be added here. This will mean things like, if a person is like a heart patient, or if they were bitten by a venomous snake earlier, or if they have any kind of chronic diseases or comorbidities from any other disease. So all those things have to be included here. Uh, when did the person eat, the last oral intake? And then, the event, how did the bite happen? The next step is about the clinical examination. So the patient is awake, alert, and oriented, or what exactly is happening. Looking at the patient, unresponsive to voice or painful stimuli, whatever it is, you have to click on that. And then what is the vitals of the patient, the BP, pulse, all that you have to add. Then we will look at the physical symptoms. So local swelling, yes, it's there. Rapid extension of swelling beyond wrist, ankle within few hours of the bite, this is not there. Now, skin urticaria. This is basically, if some people are allergic to either venom or to certain drugs which are administered. Even anti-venom can, a person can have a reaction. Anaphylactic shock is what we call it. So urticaria is basically, red hives which are there all over the body, and it is itchy. So if that kind of thing you see, then you have to administer adrenaline injection or antihistamine injections so that they sort of address that issue. Now, regional bite, lymph nodes swollen, whether it is swollen or whether it is tender, bleeding, whether it's happening. So here in our case, yes, it is happening. Bilateral ptosis, which means drooping of eyelids. Yes, this is also there. Then uh, external ophthalmoplegia. This is again something like ptosis, where the muscles of your eyelids are weak. Um, then descending paralysis, skeletal muscles painful on passive movement, which means without, even when you're not moving your body, you still have terrible pain in the joints and on in your muscles. This is generally, great bite patients experience this kind of a symptom. And then urine output, whether it is normal, whether it has got reduced, or urine there is no urine output. This basically you're looking at whether the kidney is functioning properly or not. So that is why all these parameters are there. And then urine, whether it is dark brown in color, this is basically to check whether the patient is suffering from hematuria, which means the capillary bleed in the urethra, where and the blood is getting mixed with the urine, and so the urine is looking slightly red color or dark brown. So then you have to do a 20 WBCT test. Now this is done for any snake bite, but basically the 20 WBCT test, it actually addresses whether you have viper venom in the body. So if a person has been bitten by a cobra or a crate, and we are doing a 20 WBCT test, uh, it will have no result, which will help you in treating the patient. So how do you do the 20 WBCT test? This is the chart that you have to, these are the things that are needed for the test. You have to draw 5 to 10 ml of blood from the patient's body and keep that blood in a small glass, dry and clean bottle. It can also be a test tube. And you have to keep that for 20 minutes without shaking it or, without any kind of movement. So after 20 minutes, when you upturn the bottle, and if the blood is clotted, it means that there is no viper venom in the patient's body. And if the blood is still in the liquid form, it's not clotted, then it means that there is viper venom in the patient's body. So this is the test that also needs to be done, and it can be easily done at a grassroots level. So we have added the location where this patient has come. All the details are there, and all the parameters. Then we check for A, B, C, D, E, airway, breathing, circulation, disability, exposure. All these parameters will be checked. All this information is here. So when do you observe clinical danger to go to ABCD? Here, when you click on this, then it will take you to all the various levels. So airway assessment, how do you do the airway assessment? It will go to that level. How do you do breathing assessment? It will go to that level. So all these, this information, it cannot be covered, in a, you have to download the app and check it out yourself. So the patient is bleeding from the gums, has ptosis, has high pulse rate, and had fainted and vomited, and is sweating. So you do this ABCDE approach, and you look at also the level of oxygen in the blood. What is the external bleeding? What is the blood clotting assessment? And all this, what kind of fluid has to be given? all that is there here. Again, depending on who your patient is, if it is an adult, then the level of fluid that will be administered along with the antivenom is 500 ml. But if it is a infant or a young child, then depending on the weight of that child, it will get calculated and administered, but the dose of antivenom does not change. So the dose will remain the same. 10 vials is the loading dose for crate, cobra, and for Russell's viper. And whether the infant is, say, 5-month old, or whether it is a 20-year-old adult, the dose will be the same. Only the saline volume will change. So we have given 500 ml normal saline IV, and here you have to enter all the supportive treatment and response which has uh, been given to the patient. So along with antivenom, the supportive drugs like, for example, if there is a neurotoxic snake bite, then the first thing that will get administered is the atropine and the neostigmine injections. So, and only after that they will start administering the antivenom. So the whatever is the line of treatment that the doctor on the ground is doing has to be entered here. And then suppose you have given 10 vials, but the patient has to be monitored. So there is also the you can add a reminder, every 30 minutes the app is going to remind you, like depending on what is your duration that you want, you can set it like that. And this, I think, is a very good feature of this app, to remind to do the assessments. Now, is antivenom indicated? When the bite happened, the boy felt a sharp pain in his right hand. He had vomited and fainted. On arrival at the healthcare center, he has an extensively swollen right hand. His gums are bleeding and he has ptosis. He is sweating and has vomited again. So, assign the clinical features observed and evidence from the sample history to the major venom effects of the signs and symptoms of envenoming to check antivenom indicators. So when we add all these parameters by looking at the patient, and all, before adding this, these parameters are gray in color. But after adding, and when you click on this icon, suppose if the parameters are showing envenoming, then all these will change, it will become colored. So this shows that the a person has to be given antivenom. Now, pressing the button opens the antivenom indicators and treatment. So depending on what is showing in the app, you will have different levels of information, so you have the user can read all that and update themselves exactly what kind of treatment has to be given.
Priyanka, I'm so sorry to interrupt, but just if you're able to wrap up
Yes.
in the next few minutes, just so that other people are able to present in time.
Okay. So signs and symptoms of envenoming often reoccur after successful antivenom application. So know which snake has bitten the patient, but and it is also helpful to be prepared for organ failures. So the organs affected vary depending on the snake species. So sometimes if you have a patient who is bitten by a snake which is different from the big four, like hump-nosed pit viper or Malabar pit viper or green pit viper in the northeast, or just for an example, because we hardly see king cobra bites, but if it is a king cobra bite, then it is not covered under the big four and the Indian polyvalent. So those kinds of cases will have to be monitored symptomatically. Now, because of paucity of time, I'll have to just show you quickly that the combination of all these things will tell you which snake has bitten this person. And if it is in this case it was Russell's viper, so what is the distribution of the Russell's viper? Now, once the observation data is inputted in the app, then you can save it and the full report is available. This report can be downloaded and forwarded to, some other treating doctor via WhatsApp or any other, by email, and also through the app itself. So the instructions for paramedics and doctors during the transport of snakebite victim, it is to observe the patient continuously, make repeated assessments, and enter information using the follow-up assessment tools. Now, the Snakebite Assistant app also has all this information. There is a snake identification tool. There is a snake game. What is this venomous snakes in your region? Depending on the GPS location that you have set in your app, it will show you. So there are regular updates, and so whoever has downloaded this app, you can always check for updates. Now, I just wanted to quickly show you some of the pictures. It is very important to strengthen the medical personnel skills at the primary level. The Snakebite Assistant app can be used during classroom trainings to create scenarios of snakebite cases, how to assess envenomation, what parameters needs to be checked in cases where patient has been bitten by a venomous snake but shows no physical signs and symptoms of envenomation, how to set an alert within the app. All this is available, and these are the background people who can use the app: medical college students, young inexperienced doctors and nurses, health workers, paramedics, researchers, general public, students, forest department, policy makers, educational institutions, animal rescuers, local leaders of communities, wildlife professionals, field biologists, scientists, NGOs, local government administrators, district disaster management authority, livestock owners and poultry businesses, people living close to fields and forests area. So the last but not the least that I want to talk about this app is that it can also help research. So any doctor or researcher who wants to do a study retrospectively on different cases about venom variation, regional distribution of species, and all those things. The app stores all the case of patients, so retrospectively you can use all those cases to do the study. That's it from me. Thank you, and my apologies for taking too much of your time. Thank you.
Thank you so much, Priyanka. It's always exciting to hear about your app, and all of this important information, as we know from working in Snakebite that many healthcare providers don't feel comfortable and they're really not trained on handling snake bites. So I'm really glad that you've developed this tool to help instruct people. So if you have any questions for Priyanka, please feel free to leave those in the chat. We'll have to rush forward a little bit. So thank you so much, Mr. Johan Moraes, for coming today. We're really excited to hear about your app and the huge impact that it's had in South Africa and across the continent. So please feel free to take it away.
Hi, Toby. Yeah, thank you for the invite. I just want to make sure that you can see the ASI app image. Is that visible? Toby, can you hear?
We don't see your screen.
You don't see my screen?
No.
Oh, my word. Let me see what's going on here. Let me just quickly go back to shared screen. Share. Okay. Apologies. Let's just see. Still not?
It popped up for a moment and then, okay, here we go. Now,
You got it.
yeah, we got it.
You can see
Thank
that. Okay, great. So first of all, I run a company called the African Snakebite Institute. It's my own business. And we do snake awareness, venomous snake handling training in corporate sites in about 19 African countries. We're also the largest manufacturers of snake handling equipment, snake gaiters, etc. in Africa. What I've also done is I've started the ASI Foundation, which is a non-profit company. And through the ASI, we do a lot of education. We do a lot of material. I've written, I think, about 15 books on snakes in Southern Africa. I've sold over 500,000 copies over the last 40 years. And through the ASI Foundation, we have developed over 400 posters that are available as free downloads. Every major city, every major town in Southern Africa, every major region, national parks, and we've also done a variety of African countries. What we've also just released is 96 ebooks. So what we have done is we've taken all the major cities, major towns, regions, and for each one we are developing an ebook, which is again a free download. And if you take a city like Cape Town, for instance, the Cape Town ebook would have all the common and dangerous snakes of Cape Town, first aid measures, as well as local hospitals and ambulance services. We have to end up doing over 500 of these ebooks in the next few months, and they are all available as free downloads from the African Snakebite Institute website. With regards to the app, we developed this about 4 years ago. Everything is done in-house. I'm not a government organization. I have no other funding. Everything is funded by me. And we've managed to grow the app quite dramatically. So on social media, we have about 1.5 million members, and the app has now close to 500,000 downloads. So it's very well supported. We have over 2,500 medical doctors on it. We have a variety of veterinarians, but it's really an app for the general public. Let's see if I can get this to advance. Okay, there we go. So one of the things that we've done is the species profiles. We have profiles for most of the 177 odd species in Southern Africa. And each profile has 4 color photographs, an accurate distribution map, and information about each species. We've also done easy IDs where we would take various photographs of a snake like a Cape Cobra, and then we'll have arrows pointing to those key points that you need to look at when you want to identify it. We also have a variety of easily confused snakes. So, for instance, there'll be easily confused worm slung with green mamba, what the differences are, and of course, what the differences are in distribution. With regards to removals, we have close to 1,000 snake removers or snake rescuers on our app. They are geocached, so no matter where you are in the country, if you press on removals, it's going to show you the people closest to you with their phone numbers. Now, these people are all independent people. To get on our app, you have to have a snake awareness and venomous snake handling certificate, and then you need to apply for the necessary permits from the authorities to do snake removals. So we don't govern these people, but we do list them on our app if they have all the legal requirements. And at least once a year, we contact every single one and make sure that they are still active in their areas where they're listed. First aid for snakebite. We have a very popular first aid for snakebite booklet, and the booklet is on the app as well. So it's a free download. Request an ID. In summer, we receive between 50 and 200 photographs daily where people want snakes identified. We also do spiders and scorpions. So it's a very nice service, and it's not like Facebook where 30 people have a guess. We will tell you exactly what you've seen. We have a variety of snake awareness, first aid for snake bite, and venomous snake handling courses, as well as several online courses. And the online courses are really, really popular. Our most popular one now is a kids online course for snakes. And in this app, they can download, in the course, they can download a variety of images to color in, and there's video footage and stuff like that. Local species, it's obviously very difficult to identify snakes when you're dealing with 177 species and various color variations. So we have digitally mapped all the localities for the snakes in Southern Africa. So if you're in a town called, let's say, Kuruman, you can press on local species and it will list the 24 odd snakes that occur just in that town. So that makes identification a lot easier. Our products are on our online store, and let's see what else. So there you can get an idea of the profiles, black mamba, 4-color photographs, distribution map, length, and the necessary information. For each species, we also have a medically important profile. And in these, we tell you where the snake occurs, what the symptoms are of a bite, what the first aid is, and then how medical doctors would treat that bite. So that's all included in the app as well. So there you can see an idea of a profile. You go to Albany Adder, you click on that, and you've got a variety of photographs. You've got the profiles, you've got the medically important aspects, easy IDs, all on the app. And then we also have on the medical info, we have the important scientific papers on the treatment of snakebite are there. Hundreds and hundreds of free posters. We put out a monthly newsletter. There's a link to our website with the newsletters that cover a variety of issues like snake repellents, first aid, and yeah, we do one every month. Myths and hoaxes, videos, and it just goes on and on and on. That's just the cover of the first aid booklet. That's on the app as well. We do have it in printed form, but it's available free of charge on the app. I think that pretty much covers what I wanted to tell you, Chloe. There's just some of the books that I've done. The app is called ASI Snakes. It's free for anyone to download. It works on Apple, it works on Android, and it even works on the Chinese phones. So anyone that has a cell phone can download the app. I'm done.
Great, though. That was short and sweet. Really, really interesting. Thank you so much, Johan. Um, I have a lot of questions also, and I'm sure that everyone does, but just in the sake of time still, if you're able to kind of man the chat and respond to those, it would be amazing. And thank you so much, and huge congratulations on this beautiful app. So next up, we'll be having a very different tone and a very different project. We're really excited to welcome Susana Vasquez, who has been working on a very interesting project using artificial intelligence and also a lot of different tech tools, which quite frankly are above my pay grade to understand, in order to develop new therapeutics for snake venom toxins. So I'll let Susanna explain a lot more. Thank you so much for taking the time to come here and present for us.
Yeah, hello, thank you for the invitation, and let's talk about business. Let me know if you can see my screen or my slides. Can you see them?
Yes, we can see.
Can you see my screen?
Yeah, we
Can
can
you see my
and we can
screen?
see your slides, but
Or
they're not in presentation mode. They're small. Okay,
so it's not sharing, or it's sharing?
it's shared. We can see your slides.
Okay, perfect. Okay, yeah, thank you. So I'm gonna start talking about this new approach that we use to develop a potential new and better therapeutics for snake envenoming using de novo protein design. And I mean, just to briefly mention, as you may know, artificial intelligence have been revolutionizing the world in every single aspect of our lives, including protein design. And for instance, last year, the Nobel Prize in Chemistry was for the novel protein design and for a protein structure prediction that make use of this very powerful AI tools. I was very privileged to work with David Baker for my PhD. And I'm also showing this slide that this technology is very powerful and will impact many areas in health. But one of the main applications we think this could really change the way patients are treated with for a snake bite are using these tools. So, for instance, this work I'm going to discuss was presented on the Nobel Prize lecture last year. I'm just gonna discuss more like technical kind of work that we published recently this year in this study. So basically, in this study, we used artificial intelligence tools to design proteins to neutralize a medically relevant group of snake toxins. So very generally, we just try to neutralize alpha neurotoxins and cytotoxins that belong to the three-finger toxin family. I mean, I'm very sure you all of here are very familiar with the traditional treatments for a snake bite, and I'm just gonna compare the traditional approach with this novel approach we want to implement. So in this traditional approach, of course, you need to immunize animals like horses or sheep with whole venoms uh, to induce an immune response that will trigger the formation of a polyclonal mixtures of antibodies that could neutralize these toxins. The blood is collected, the antibody mixture is purified, and then there is a formulation for the antivenom. This is very effective. That this is actually the standard treatment. If you get bitten by a snake today, you will get this at the clinic. But of course, this has some issues because you have a batch variability in the production process for antivenom. This could be also very expensive, relying on horses every time. Um, this could also lead to limited access. For instance, the delivery of these therapeutics require a cold chain system, which is not always feasible in remote areas. You have also the risk for allergic reactions because besides injecting the patients with neutralizing antibodies, you are injecting a bunch of foreign proteins from the horse or the animal. So we think that the novel protein design is a very novel alternative to these treatments because first of all, you don't rely on animals, but in computers instead. You can just provide the structure, the three-dimensional structure of these toxins, which right now we can predict very accurately. We can fit these structures into these very powerful algorithms that I just discussed. So for instance, we can make proteins that bind to them so they block their function, and we can produce them in microbial systems that are easier to manipulate and much more cheaper, and we can formulate them, which actually has many advantages compared to the traditional approaches. For instance, we have very limited batch-to-batch variation because this is like genetically encoded. So every time you get the same product, you can produce them at scale, probably much more cheaper by using fermentation systems. These proteins are tuned for high affinity and high specificity. They could be discovered very quickly, and they are highly thermostable. So you don't rely on the cold chain system. For instance, this is very scientific, and I don't really want to discuss in detail any of this. But some of the key findings that we describe in this study is that this idea of making proteins from scratch that block key snake toxins, it really works out in a very awesome way because, for instance, each class of toxin here is represented in a different color, and the designed proteins are all represented with these gray structures. And you can see that these proteins can be designed in the computer, they could be purified, they have monodispersed traces in the chromatography process. They bind very tightly to their targets with even self-nanomolar affinities, and they're highly thermostable. So for instance, here you have the medium melting temperature for these proteins, which in some cases exceed 95 degrees, but in other cases are 78 degrees or 61 Celsius degrees. And besides working very well in the lab, we were able to obtain the crystallographic structure. So this is not a computational model anymore, but we experimentally characterize their three-dimensional structures, which are here superimposed with the computational design. So the crystallographic structures is shown in white color, and the computational design is shown in gray or color. And you can see that when you superimpose them, these structures are identical. So that means these algorithms are super powerful to design with atomic accuracy proteins that can block two key snake toxins. Something very important is, of course, these proteins work in the lab, or do they actually work if you test them in animals or in cells? And the answer is yes. So for these results I'm showing right now, what we did was to inject a group of 5 mice with a very lethal dose of neurotoxins. For instance, 3 times the medium lethal dose. And then we administer our treatment. So I'm not going into details here, like in terms of the classes of neurotoxins we used, but we have two classes of neurotoxins, short and long neurotoxins that inhibit different classes of acetylcholine receptors. And we can see that in a control group that is just injected with the snake toxins in a very lethal concentration, if you don't administer any kind of treatment, all of the animals die in 24 hours. Um, so we know that this is like a very lethal dose. If you apply a cross treatment where we inject the wrong protein to the wrong neurotoxin, these treatments also doesn't work. So that means these proteins we made in the computer are very specific, but they also work in different contexts. So for example, in a pre-incubation experiment where you first premix outside of the mice the toxin with an excess of our treatment 30 minutes before, you give to the animals this concentration of proteins, and all of the animals survive after 24 hours, regardless of the kind of neurotoxin that is tested. We also tried a more realistic approach where we first inject the snake toxin and then added our treatment. For example, we have a delayed administration 15 minutes after snake venom exposure. And we can see in this condition, 100% of the animals survive. If you start like waiting longer, like instead of 15, but 30 minutes, for some of the neurotoxins, it's still pretty effective, but for some of the toxin, the efficacy decrease a little bit. And also we try to decrease the dose of our treatment. So instead of having 1 to 10 molar excess, we tried 1 to 5 molar excess. And for our best design, this protein was 100% protective, while the other was about 80% protective. And just very briefly, this is very exciting for neurotoxins. We also target cytotoxins, which are not as lethal, but they have very bad consequences into snake bite victims because this could lead to dermonecrosis or amputations. So in this case, what we did was to expose cells from the skin keratinocytes in a petri dish to very lethal concentrations of whole venom from cobras that we know are very cytotoxic, and then administer our computational design proteins that's supposed to neutralize them and evaluated their viability over time. So you can see that in a positive control, where we just added like media to the cells, so something that should be not harmful, all of the cells are alive. If you have a negative control where you add a detergent that can also disrupt cell membranes of cell membranes, all the cells are dead. If we added our treatment in the absence of any venom, our protein design is not toxic for the cells, as the cells are very viable. And in these different conditions, we have venoms from different cobra species that I'm just showing here. The minus sign means that our treatment was not added, and the plus sign means our treatment was added. And you see that in every condition, the administration of our computationally designed proteins protect cells from dying, which is very, very exciting. So I think this is like from a scientific or proof of concept perspective, this is very exciting, and we know it works very well. And in here in this table, I just tried to make a brief comparison of our new technology or the potential of our new technology to improve these treatments with traditional antivenoms or other alternatives that are out there. So for example, beside de novo protein design, people have been trying to use recombinant antibodies like monoclonal antibodies or nanobodies for treating snake bite, or even repurposing small molecule inhibitors. And I'm just comparing different categories like safety, tolerability, um, product stability, cost, many aspects. And we can see that even the traditional antivenoms they have very good performance for many of these categories. But there are things to improve. So for example, the safety is low, and our de novo protein design mini binders, they should be much more safer. They should be much more stable to be stored and delivered to the high risk regions. We also think they must be cheaper. Um, Traditional antivenoms are normally administered intravenous, but these very small resistant proteins could be more flexible for delivery formats. Like, for example, we know we can formulate these proteins into oral administration, and I mean they're very like tuned. We can fine tune the systems to make like antidotes for different classes of snakes very quickly. It's still not approved. The discovery time is much more faster, and we don't rely on animals like the traditional antivenoms. Of course, this is very exciting and it's very academic, but I think like spaces like this meeting are very exciting because bring together different types of expertise, and actually to bring this to the real world, we need to collaborate with people in different fields. So one of the barriers to translate it into clinic is that we don't have regulatory pathways for this new class of biologics, and probably these molecules cannot follow the same path as regular antivenoms. We need to still answer questions of how to formulate them, how they interact with the body is something that we still don't know. We also would need more funding to support these studies because currently there is very limited funding. Um, Mostly the funding is focused on early stages, but we need funding for later stages, like I just discussed now. And something that we would need to do is to develop cocktails of these computational design proteins for different regions in Asia, in Africa, in Latin America, etc. How to make this possible? I think overall we're very hopeful that this has a lot of potential from the scientific perspective. This is a very powerful tool, but we need adequate support, investment, and research to make this to bring this into the real world. And of course, requires a close collaboration not only between scientists but the pharmaceutical industry, public health system, governments, and people like you that are part of this meeting. And just to finalize, I'm just want to acknowledge the people that were part of this project that I'm showing here. And with that, I'm done and happy to answer some questions. I don't know if I took too much time, but I'm done.
No, this was really amazing. Thank you so much, Susanna. Uh, just for a little bit of context, I had the huge privilege of speaking with Susanna, I think a few months ago. And this conversation about the end of her presentation about how we can take things from discovery to real life really changed my whole perspective on what we need to focus on as far as funding goes. Like education is really key. And also, I think all of us have seen so much money go towards discovery, and we have a lot of exciting things to pursue now. So we're really hoping that we can take these things forward, and I really hope that we can have some low cost, effective drugs. So I'm really, really excited about your presentation, and I'm going to be sharing this recording everywhere if that's okay with you.
Yeah, yeah,
And
absolutely.
hopefully it can move forward. So thank you so much. Um, let's see what time it is. 9:33. So we'll also have to move forward, but if you're able to stay for a few minutes, and if anyone has questions for Susanna, please feel free to drop them in the chat. So next up, we'll be having a presentation from the biologist Mariana Castro Ramirez, who will be presenting from Mexico on the app Retox. And so I'm really excited to learn more about this app. Quite frankly, I don't know anything. And so it's really exciting to see this type of activity and outreach being done in Mexico. And thank you so much for taking the time to come here today.
Yeah, thank you very much, Chloe. Just give me 1 second. Can you see my screen? Can you hear me?
Yes, we can hear you.
Okay. Can you see my screen?
Yes. It's not in presentation mode, but we can see your slides.
Okay. Thank you for the invitation to this forum, where I will talk about red dogs. My name is Mariana Castro. I am a biologist and the information coordinator for red dogs and product manager for antivenoms at Laboratorios Silanes in Mexico. Well, we have to start talking about if we have in Mexico a reality that is huge. So we have a problem or many. To begin, we need to address what is happening in Mexico. Envenomations caused by scorpions, spiders, and snakes are a serious public health issue in Mexico. We rank fifth in the world in biodiversity, which means there is a high incidence of bites and stings. We are the country with the highest incidence of scorpions stings worldwide, with more than 3,000 cases every year. Regarding epidemiology, work is being done jointly with the National Center for Disease Control and Prevention to ensure that physicians correctly register bites and stings, instead of only recording the complication caused by envenomation. Also, in Mexico, not all healthcare professionals graduate with proper training to diagnose and provide the correct treatment for these cases. Furthermore, not all hospitals have antivenoms available, which can lead to more severe cases of poisoning and life-threatening situations. Well, the creation of red dogs. Due to this reality, Laboratorios Silanes, Mexico leading producer of antivenoms, took on the mission of bringing together experts from different parts of the world to unify criteria for the diagnosis and treatment of envenomations caused by venomous animals. For this effort, Red Dogs was created. So Red Dogs is a network of multidisciplinary specialists and researchers dedicated to disseminating scientific information on spiders, scorpions, and snakes of medical and toxicological importance in Mexico. Among the tools we have developed is our website, but today I want to focus on the Red Dogs app, which mirrors the content found on the website. The Red Dogs app is available for both Android and iOS devices, and it is completely free. All the information you will find there is scientifically supported and created by experts in the field. Now I will show you a short video of what you will find in this app.
Well, you can download the app for Android or iOS, and then you enter, and you can be registered or access like a guest. So there's information about prevention, what to do in case of a sting or a bite. Also, you can see information about the hospitals and the experts that know anything about these cases. Also, you can see videos and read articles about animals, poisonous animals. And if you are in some location in our country, Mexico, you can also see this information like more accessible. When you are in, you can also download some pictures for your mobile. Look, we have this available right now. You can see the experts, the new ones. Also, you can see the species that are in your location. Some new articles right here. And also, if you want to go to the species, like in Mexico City, we don't have like scorpions, but we do have spiders and some snakes, but we can change the place where you live. And like in Guerrero, there we have scorpions. So you can select which kind of animal you want to see. Also, talking about the experts. Also, here we have the ones of Mexico City, and you can see the universities in which we give some advertisements, and also the vinculations that we have. Here are the ones. We also have the blog section in which you can read and learn from so many articles from scorpions or spiders. You also have the option to select, right? If we go to the first part, we only have information about preventions, and well, that's it. And we also have this emergency button that calls to the 911 or send a message to a person that you already have registered that you are in an emergency situation. And also, if you have been bitten by a snake, what to do, no? This is very important. Also, well, you can find the hospital nearest to you. And again, all the hospitals that have people that have the knowledge about the diagnosis and the treatment to use in case of scorpion sting and snake bites and spider bites.
Okay, so this Red Dogs app has more than 17,000 downloads. And also, we provide a special identification service, so you can send us a picture of the snake or spider or whatever you want, and we return the answer by email.
Well, you can download the app for.
Okay, talking about our activities on Red Dogs, although our time today is short, I would also like to mention that Red Dogs carry out many other activities, such as risk mapping based on the epidemiology of a Mexican state, which allows us to identify critical routes or care. So you can easily go to a hospital in case of an emergency. Specialized work in each state according to the species present in that region, creating compendiums with information ranging from population density and local flora and fauna to the hospitals affiliated with red dogs that have trained personnel of antivenoms available. Also, we have a section called Red Dogs Editorial, where our experts produce valuable content such as articles, books, infographics, and more for both the general public and healthcare professionals. I have to say here that last month we are working in a document. You can enter to the section of blog, and every month we talk about something different. Last month we talked about reclusive spider, and this month we are talking about viper snakes. We also do the development of videos and educational materials in indigenous languages, focusing on accident prevention and what to do in case of emergencies. Thanks to collaboration with the government, we have ensured that weekly epidemiological bulletin now records scorpion stings and spider or snake bites by state. This helps us improve antivenom distribution so patients can receive the appropriate medical attention in time. And also, every year we train more than 50,000 doctors and nurses that envenomations are treated promptly, avoiding health complications and saving lives. So in summary, we have like 5 questions that Chloe asked us to answer. So how did this app come about? It was created by Red Dogs and Laboratorios Silanes to provide quick, expert-based information on diagnosis and treating envenomations for scorpions, spiders, and snakes to improve prevention and medical response. Also, what are the main app features? Free Android and iOS access, species database, hospital directory with trained staff and antivenoms, species identification service, and prevention materials, some in indigenous languages. How was the rollout and user base established? Through promotion on our website, social media, healthcare networks, and partnerships with institutions like Mexican Red Cross, reaching health professionals, students, and high-risk communities. What challenges have you faced? Internet limitation in rural areas, keeping epidemiological data updated, and ensuring ongoing user engagement beyond emergencies. So how do we imagine the future with Red Dogs? Well, adding real-time hospital geolocalization, because when you download the app, you decide if you want to have the geolocalization or not. So the intention is to invite to all the people to activate this section. Also, we want to create an AI-based species identification, but it is very difficult because we have a lot of venomous species here in Mexico. We have tried this like for last year, and well, we are trying. We are on that way. We also have to improve the offline first aid protocols. I saw the last app in that one person talked about, and it is great. I have to improve this here in Mexico. Also, we have to add personalized alerts and integration with emergency networks. And that's it. I invite you to follow us in our social media. And if you scan the QR code, you can have my WhatsApp if you have any question. That's it. Thank you for the invitation. If you have any questions, let me know.
Thank you so much, Biologa. This was a really interesting presentation and yeah, exciting to see this app taking off. I've downloaded it, so I'm excited to just kind of explore how things work. I think that we have time for maybe 1 or 2 questions. I know that I have one, and I'll leave time for someone else. I downloaded this app and I visited some snakebite patients around Chiapas and Oaxaca. And I noticed that a lot of the hospitals, which were supposed to have antivenom, sometimes they run out for various reasons, like they don't receive a shipment or inventory problems. So I was curious if you have any plans to integrate some sort of a live inventory. I think that would add a lot of complexity, but how do you deal with this issue?
Well, that's a big job because we work with the government to distribute the antivenoms in at least the big hospitals of every region. But with the new president that we have in our country, they bought the antivenoms very late. So we start providing antivenoms like 2 months ago. So the hospitals, like 6 months, didn't have antivenoms. So that was horrible. And we don't really know how many people died because we don't have that data, but it is very dangerous for people because they can lose a leg or an arm or I don't know. So right now, the people that we work here in Laboratorios Silanes, the sellers, they have a work in which they have, when we sell to the government the product, they have to see that the product has not to be in storage. It has to be in the hospitals. So sometimes the states in our country have the product, but in storage and not in the hospitals. And that time that it took can be a risk for the patient. So we work with the hospitals and the storages and the government to have the product where it has to be. So if you know that there are some hospitals that doesn't have the product, yes, it could be, but the big hospitals has to have the product.
Great. Yeah, that makes sense. And I hope that there will be some sort of incorporation in the future that they're able to integrate the storage with the hospital needs. You know, it's less of a snakebite problem and more of just a whole systemic public health problem that every country faces. So thank you for sharing this.
Thank you very much for the invitation.
Do we have any other questions for Mariana? Or now that we have some time, if anyone has questions for our other speakers, you can also feel free to share those. I think we have one more presentation today from Dr. Jacqueline Sachet from Brazil, but she's just coming in a minute or so. Okay, she seems to be here. Great. So if there's any more questions, feel free to leave those in the chat. Thank you so much, Mariana, for sharing this presentation and your work.
You're welcome.
Yes. So without further ado, I'm really excited to introduce our last but not least incredible speaker today, Jacqueline Sachet. So Jacqueline is working in Manaus at the university, at the Foundation of Tropical Medicine. And she's an incredible researcher who integrates a lot of different aspects of snakebite from the logistical issues in terms of reaching hospital care to more clinical aspects. She really does a little bit of it all. So I'm actually very excited to hear that she's taking over this app project in Brazil. So I'll just let you present on SARPA in Brazil, Jacqueline, whenever you're ready.
Thank you for this moment for presenting this app. Is a tool, innovation tool for snake emergency response. This name of this app, this tool is a Serpent. The Serpent is an app. The first app original was built in India, and they contacted this team in India for replication this app to Brazil. And this app is a pilot app. I need this a building app, but the first version is okay for download for using cell phone. Then I thank you again for this opportunity for explain about this this app for help in cases of the snake bite. The first part of this app is a simple screen. The first screen is a mobile application and they use for response about the emergency, about the snake bite or snake rescue, for example. In the first part, you don't need the register in the name for use the first part. Because this is a quickly used for find a treatment hospital. This app is only for Brazil hospitals. And when you click in this part, for example, you can use the Google Map for link for find the more near hospital for receive the antivenom in Brazil. So this is a first part is a quickly emergency response about the snake bite. And if you can use this for database for the snakes, for example, because inside this app, I will show about this part, is a snakes database for different identification a different gender of the snakes in Brazil is possible when you use this app too. You can use too for education. There is material about the guide for management of the clinical snake bite in this app. Material for download you can find inside this app too. And the scientists can use to collect data for analysis because you can register the local of the identify one serpent, for example, or local that occur snake bite. And when you navigate in this app, you can change the language for English and in Portuguese. You can use the profile for navigating for register one snake or register one snake bite, for example, or need help for identify the snakes. There is a list of the snakes in this app for list the more often snakes in Brazil, and there is information about the app too. The second screen of the app, can you find snakes of the Brazil, the guide, complete guide about this, the orientation for the first ID for the snake bites too. You can use the chat for answer and the face-to-face, for example, about the snake bite or doubt about the snakes too. It is a example for the change the language for Portuguese or English. You can change your profile if you identify like a specialist for the help something. You can change in the ask for change the profile to inside this app. This is a example for the edit the profile. Okay, and when you use the app for report a snake, for example, you can use the screen for take the photo of the snake, and you can find the name of the snake and the link with the photo. Or if you not the species or the gender of the snake, you can ask help too for identify and make a linkage for the photo and the name of the snake. And the second item is about the report the snake bite. Then it's the same logistic for the register. You can use for take the photo, take the number of the phone, for example, and the basic information about the incident, for a briefing for the specialist for help about the management of the clinic of the snake bite. The third is about identification of the snake. You can register the snake, the first, and the other tools of the app is about the help for identification. You can only for about this snake for kinology for this snake, or kinology for the snake bite. You can choose in this screen if you kinology or is association snake bite. You can take the photo again, and the specialist you help about description of the snake. Other tools, this app is identification of the many types of the Brazilian snake. This is an example for identification. Put the photo, there is the photo, the name, scientific name of the snake, the popular name of the snake, and a little bit describe this snake, the environment, this snake, the size of the snake, the color, is about information, this species. Many species, there is a list more than 100 species in the identification list in the app. Can you, the person that use this app is update about the local of the person there is in this moment for they take the photo. In the same time, take the geographic localization. For example, when you register your place, when you use Google Maps for the go to the hospital more near for the treatment, for example, is more easy for the app linkage Google Maps for the put the route until the hospital. And the sequence of the screen is about the app, and this is a detail the species that I told you about this. These are example about the use the filter. For example, I would like access the list of the snakes and made the different types of the snakes there is in Brazil, for example. You can find the name for the snake or use all the list for the improve the technology about the snakes, the description, the name, this popular name, the official name, for example, you can use for the only for the knowledge too. And this is an example about the hospital list. When you looking for the hospital that is anti-venom for use, all this hospital there is anti-venom in Brazil, you can use the own localization and put mark using Google Maps for find the hospital more near, and you click and use the Google Maps for the put the route for the hospital. Is a example, the hospital, the point of the person, and the hospital more near the person. And the next is about the education, the material for education. Is about the what you do or what the don't made for the first ID, for example. There is many materials about the snake bites, the clinical management, the first ID, about the technology, the description of the snakes in Brazil. There is a folder that is the four mainly species of the Brazil, the coral snake, Jararaca is a lancehead. Cascavel is a Crotalus, and Surucucu pico de jaca is a Lachesis. There is opportunity for interaction too in this app. You can make a chat for response about one accident or one doubt about the snakes. It's possible use this tool in this app. And the other materials, it's possible make a download in this app. This is a guide for treatment for the snake bites. Is a book for the child too, about the history with the learned about the snakes or snake bites, the first ID. And in this app, I can use the platform for the management or improve this app. This app in this moment is a second phase. The first phase is a building this app, and the use is you can download this app for the free in the cell phone. And the second phase of this app is a validation this app, improve the text, improve this image. And the third is a change in the update of this app, and it spread this app more in the country for using the tourism in Brazil, use this app, student use this app, person that live in the rural area, in the forest, or person that stay in the city, for example, because in Amazon, in the city, there is snake too. It's possible need this app. This is for help the person, the student or the specialist, or only one person that visit Brazil, for example, can use this app for help find the hospital or identify the snake, or is a help for the first ID, for example. Is an example the map of the hospital, the view in the management, in the control, management control, and this is a testing this mobile application. Needed to improve the list of the hospital, the species, and prepare all the material for ads in this app, like videos, all the material, and bug fixing too, because it's possible, because it's a test yet, but you can use in the cell phone. This is a team. Welton, Manuela, Pedro, Amanda, Vitor, and the CEP clan that is a research group in Manaus, Coleção Anime, and all the institutions that help this app and the other project in the university about envenomation by animals. This is a thank you. This is you can use this image for the download this app. You can take an interest about this app. Thank you for this opportunity for the share this this app with the colleagues. And if you can doubt about this, I can explain something more. Thank you.
Thank you so much, Professor Jacqueline. This is a amazing presentation and really exciting to see how you're taking the Serpent app and its success in India and adapting this to the Brazilian context. So actually, I don't want to put them on the spot, but we do have Jose and Naneshwar here who played a huge role in the development and the rollout of Serpent in India. So I don't know if you guys have any questions or comments for Jacqueline. No pressure.
Yes, the original app is in India, the Ninja. And this app in India is a very old, is a very good platform of the information, the Snakebite Ninja. It's a very good spread, very good acceptable of the person, and they use a lot this app in India.
Jules, do you want to ask anything? I know that Jules is, I think Jules is here.
Kenny, I'm around. I can hear you. Manuel, I'm here. I also have a bad internet connection.
Yeah. Jackie, what's the scene right now with Serpa in Brazil? Is it being fully functional, or are you seeing any hurdles in implementing it?
No, it is as far as I can understand, it is a pilot version. A lot of people participation on the ground is what we need. As I told in my first part, is the biggest challenge everywhere will be is getting the government to support and the people to download and rescuers to be part of the network. So you need a very strong machinery behind this. Ganeshwar, you know how your home state or your working home state is trying to adopt it, and the kind of roadblocks or the kind of challenges which we face. So a lot of groundwork, a lot of homework, a lot of team building on ground is needed. As I told earlier, technology is one part, but mobilizing that human element is very important.
Maybe Jacqueline, if you could say if there is any hurdles that you're facing with implementing Serpa in Brazil, or is it smooth, or do you see any uh, gaps or pitfalls?
Yes, I try spread in Congress in Brazil for implementing Brazil. There is possible downloading in the app for free, and now the team realized that needs some adjustment of the app for the text or improve something. And this time, my team made a evaluation for Brazilians specialists for the improve this app. But the third phase is available this app for iOS, because now only for download is possible, is available for Android. I need put the opportunity for download for iOS platform too. Is will happen more more is will happen when I finish the validation this app and improve some parts of this app. But for implementation in Brazil, I will offer for health minister, for example, offer my colleagues in university in Brazil for spread this app. I will have a contact for health minister for the link this app for a device and put this app, the link of this app in the page of the official health minister.
Okay, I think Jose agrees to this, but iOS is very possible. It takes a little bit
Yeah,
more of
yeah,
effort.
Gani, because in India also we don't have an iOS version fully functional, and probably in another 6 months we'll be able to bring an iOS version. There are certain technical hurdles with iOS when we try to develop it because of the location fetching and um, you know, real time data about the rescuers moving in. So that can be addressed, and we are working on it. And Jacqueline, I think I can ask our team when we develop the Indian iOS version, we'll update your Brazilian version also. That's something which we can do. Yes, more and more people are moving towards iPhones.
Okay, thank you, Jose, for helping us with this app. This app is built 2 3 years ago, but now is a moment for the improve this app with my team because there is a many projects, many different opportunities in different time for insert this app in the health minister. Thank you for help us.
All right. I just actually messaged Alan to schedule a meeting with you because we are in the process of updating Serpent for the iOS version. That discussion and the tech work is going on. We can simply incorporate those changes and let's come with the iOS version for Brazil also.
Okay. I think it is the moment for the meeting again.
Yeah.
If there are no other questions, I have one other question. I'm curious about your plans in terms of snake rescuers. I didn't see very much snake rescuer activity. I don't know if how common it is to have the snake rescuers or people who relocate these snakes. And if this is not something that happens, do you have any plan of how you hope that this app will reach the general public, especially communities?
So I suppose that question is to me.
Oh, I'm
No problem. Can you answer? No problem.
No. It is I'll Jacqueline, you answer and I will answer from the Indian side.
Okay. In Brazil, there is a team of the rescue. I don't remember the English name. Is a, a pompier, bombeiros.
the fireman.
Fireman. The fireman can you rescue the snake, for example, and this app you can connect for firemen for the when the person report the rescue the serpent, for example, the firemen go to the place and they take the snake. And the other or which state in Brazil there is a organization that rescue serpent. Then I need to find the list this institution that's responsible for the rescues snakes, for example, when the person puts in the app about the rescue serpent, I will connect or put the list of the phone number for the contact, the institution for the rescue the snake.
Yeah. I'll quickly add from India, we have a good number of rescuers across the country. Most of them are self trained. Then some of them are trained professionally, and also state forest departments provide the service of snake removal in many states. So we have a large number of rescuers in India. The challenge is this large numbers to ensure that they all follow protocols and SOPs when they rescue snakes. Otherwise, many of the snake rescuers who are doing amateurish or untrained snake rescues themselves fallen victim of snake bite. So that's another challenge which we face.
Great. Thank you both for sharing this. And thank you to all of our presenters for the talking about your work and also for the immense amount of time that you've put into these projects. And I guess sharing all of your knowledge so that we can all learn from each other. So if there are no further questions, then I just want to thank you all for attending today. Thank you for this time. And I really appreciate all of you for coming. You can keep up to date or send me a message or send a message to the Snakebite Community Engagement Network in case you're interested in future presentations. Our next webinar will be covering improvement to antivenoms. So if that interests you, you can also reach out. So thank you all very much and have a good rest of your day or good rest of your night.
Thank you, Chloe.
Thank you, Chloe.
Lovely.
Thank you.
Thank you.